Okay, so hello everyone. Thank you for joining us today on our COVID-19 update. My name is Stephanie Badillo Sanchez. Hello everyone. And I am the communications specialist. As a reminder, these updates will be in English one week and in Spanish the next. So the next English update will be on March 16th. Hola a todos, gracias por acompañarnos hoy en nuestra actualización de COVID-19. Un recordatorio, tendremos estas actualizaciones en inglés una semana y en español la próxima. El próximo martes tendremos una actualización en español en vivo en Facebook a las 6 p.m. Por favor, únase a nosotros la próxima semana y si tiene alguna pregunta, podemos responderla. So this week, we've received an increased number of COVID-19 vaccines. We will be hearing from Nathan Johnson, Local Emergency Response Coordinator, to give us more of an update on that. And additionally, we also have Dr. Yeka, Interim Health Officer at the Yakima Health District, who will give us also more information on COVID-19 vaccines. If you have any questions about the COVID-19 vaccines or the vaccine distribution piece we're currently on, please make sure to put them in the comments section as I will be monitoring it on Facebook. If you have any other questions outside of these topics, you're more than welcome to leave them in the comments, and those will be addressed either at a different COVID-19 weekly update or can be replied to directly on Facebook. Alrighty, so first we will be hearing from Nathan. Nathan, what are the new updates about the COVID-19 vaccine?
Yeah, thank you. So as of this week, we have received a total of 39,057 first doses into Yakima County. We've administered 25,148 of those. We've also received 19,560 booster doses into the county and administered 12,015 of those. One of the caveats I want to give on those numbers is the reason that it looks like we have almost 15,000 first doses available is because this data is pulled at the beginning of the week. And that is when these organizations or hospitals or clinics and pharmacies receive their shipment from the state at the beginning of the week. So these vaccines don't sit on shelves for too long. They fly off and they're like hotcakes. And our providers do an outstanding job at having creative ways to push those out to the community who falls under the current phases. I do want to touch on the four main ways that vaccines in Yakima County currently. The first way is through our state allocation. So the state receives an allotment each week, and then they break that down into counties and organizations within those counties. Another one is through a federal Walgreens partnership program, and that is where Walgreens and CVS pharmacies receive the vaccine directly from the federal government, and they're able to work directly with long-term care facilities, staff and residents to get them vaccinated. Another one is through the overarching organization, the federal organization over our federally qualified medical centers. This is a program to push vaccine doses into communities and vulnerable populations throughout the country. Farm Workers Clinic was one of 3 initial FQHCs in the state to be selected for that federal program. That is being expanded, and Neighborhood Health will be joining them as part of that program in the coming weeks as well. Another, the last and fourth way for vaccine to come into the county is through a federal pharmacy partnership program, where our larger chain pharmacies, such as our Walmarts, our Costco, Safeways, receive vaccine directly from the federal government, and they're able to push that out. Regardless of how that vaccine comes in to the county, all organizations do need to continue following the correct state guidance. So right now we are vaccinating 1A, Tier 1 and 2. That's our healthcare workers, our first responders, and our long-term care facilities. And then we're also doing 1B, Tier 1, which is anyone who is 65 and older in anyone who is 50 and older in a multi-generational household. There is news that has broke this evening, both on the federal side of things and on the state side of things, where President Biden has issued a statement pushing for states to start vaccinating teachers and licensed childcare workers. In following that, Governor Inslee has announced that as well, and there's been media releases from the state side of things that has rolled out this evening regarding that. Currently, Yakima County, Yakima Health District, and all of our partners who are vaccinating are still waiting on the official guidance on how this program will roll out from the State Department of Health. So as soon as we get that, we will be pushing additional information out to the community to clarify who falls under that category and how they can find an appointment to get vaccinated. But I do just want to clarify that real quick. I do want to touch on the Johnson & Johnson vaccine. Very exciting that it's been approved through the FDA for emergency use authorization. In Washington State, we'll be seeing some as soon as next week. It is, again, a very effective vaccine. In recent studies over it, it's been found to be 85% effective against severe COVID-19 globally, and then 72% effective against moderate to severe COVID-19 just within the US. So still a very highly effective vaccine. There is concerns that it is less effective than our Moderna and Pfizer vaccine, but that doesn't take away from how effective that vaccine still is. When we look at our normal flu vaccine and other vaccines, we see usually an average effectiveness of those being between 40 and 60%. So definitely this is still a very good option for people. And when we talk about what is the best vaccine, the biggest message is the best vaccine is the available vaccine. So please do not hesitate. If you have an opportunity to get the Johnson & Johnson vaccine, don't hesitate to try to get a Moderna or Pfizer, because all three of those are very good options. And even if you get the vaccine and do get COVID, you still have a way less of a chance to have adverse health impacts, wind up in the hospital and things like that. So very, very exciting that's rolling out. The only other thing I wanted to real quickly touch on is I know there's a lot of rumors going on throughout the county on people who don't fall under the current phase guidance. What I will say to that is that all of our providers who receive vaccine from the state have to follow the state guidance, and they have to essentially answer to the state, ensuring that they are following that. But also, we cannot waste any of those doses. So if any of those doses are set to expire, or they have extra doses and they don't have anyone who's under the current phase that are around, then that's where the whole overarching goal, which is to get shots into arms, and we can't waste any of those vaccines at all. So I did want to clarify that as well. And with that, I covered a lot there. So open to any questions from anybody.
Thank you, Nathan. Looks like Chris on Facebook has a comment. Most significantly, the treatment group of Johnson & Johnson had no deaths and no hospitalizations due to severe disease.
Yeah, absolutely. That was to my point of even though it is less effective against or opposed to Moderna and Pfizer of contracting COVID, it still very much protects you from those severe illnesses and winding up in the hospital and or death. So always a good option for that.
Okay, thank you, Nathan. And now we will be hearing from Dr. Yeka.
Okay, people want to know what's the difference between the Johnson & Johnson and the Moderna and Pfizer. Moderna and Pfizer are messenger RNA type vaccines. They're brand new to the vaccine field. They're not new in research, though. They've been used in cancer for many years. It's the messenger RNA. The body builds up immunity to the cancer cells and destroys them, and it's been very effective. So it's not brand new technology. It is new technology for COVID. And so they're very effective. Little downfalls, or is it because of the cold storage, especially with the Pfizer that we have to deal with? So then the Johnson & Johnson, it's a different modality. It's also new, fairly new in the vaccine world. The new Ebola viruses are using this technology. It uses genetic material from the spike protein of the COVID and attaches it to an adenovirus. An adenovirus is very common. This adenovirus is not infective and it doesn't duplicate in the body. It just presents it to the body, and then the body builds up immunity to the genetic spike protein. So they differ in the technology and how it's used, but both very effective, and it's not brand new technology for either one. But it is much needed in the vaccination world. We're still, with the flu vaccine, is using 50-year-old technology. So it's nice to see some of these new modalities, and hopefully will be bright in the new vaccine future for new vaccines. So they're both. There are some advantages to both, and the new Johnson & Johnson is a one dose, and it makes a lot of difference, especially people that it's hard to get vaccines in that modality. So that's a big advantage. And like Nathan said, it's not quite effective in preventing complete illness, but it's very effective in severe illness and hospitalizations. And the other thing is it has shown to be effective against the variants. And so I think that's very important too. So all three are excellent vaccines. And like Nathan mentioned, Dr. Fossey, mentions that the best vaccine is the one you can get in your arm. So I would go with that. And the other advantage that it looks like now, because it's just been announced that the Johnson & Johnson will be manufactured by their competitor, Merck companies, under the War Act. So that's a good addition and will give us a lot more vaccine in the more immediate future, which we really need. That's our real problem now is vaccine supply. We've got plenty of people to give it to. We just don't have that supply, and bear with us. But I think all of the vaccines are very good vaccines, and we're lucky to have them. You want me to go into the next, or?
Yeah, let me go ahead and check to see if we have any questions on our
Okay.
Facebook. Give me
Fine.
one moment here. Okay, so we do encourage those viewing us, if you have any questions, please put them in the chat box, as we will be viewing those and addressing those. But it looks like for now we don't have any questions. I could ask a few questions to you guys. Nathan, do we have a timeline of when the Johnson & Johnson vaccine will become available?
Yeah, so the state is expecting to get the first shipment of some Johnson & Johnson as early as next week. What I will say is, just like with all the vaccines, as they first start being produced, it does take some time for us to be able to see a steady stream of those. So just because we receive some next week doesn't necessarily mean we're going to have a good supply of that vaccine for weeks to come afterwards.
Okay, thank you, Nathan. And then Dr. Yeka, if individuals become fully vaccinated, do they still need to wear masks and follow public health recommendations?
Yes, we're still recommending that. We still don't know the long-term effectiveness, and it's still prudent that we still wear masks, social distancing. There are some real benefits of being vaccinated, though, in quarantine. If you are exposed to anyone after you're completely vaccinated and have full immunity, that if you are exposed, then you don't go through the normal quarantine. You just check yourself, make sure you don't become ill. But so that's a big advantage, especially people that are working around others and are prone to be exposed. It's a big advantage of that. And once individuals that, if they do become symptomatic after they've been fully vaccinated, we need to know that too. There has been some breakthroughs, but it's very, very minor, but we like to know those. So if you give symptoms of COVID after you've been fully vaccinated, let your health care worker know, and so we can follow you up with that.
Okay, thank you, Dr. Yeka. And it looks like we do have a question on Facebook from Michael. Michael asks, if someone has lupus, is it safe to take the COVID-19 vaccine?
Yes, your autoimmune disease are not a contraindication. If you have any question at all, check with your primary care provider. But if you're, that's not a contraindication for taking the vaccine, any of them.
And then Michael also asks, what if you have had cancer before? Is it still safe?
Even if you've had cancer, that's not a contraindication either. Now, if you're on massive steroids or something like that, then you need to check with your provider before you get vaccinated.
Okay, thank you, Dr. Yeka. And Nathan, will individuals get to choose which vaccine they receive?
No. An individual will not have the opportunity to select what vaccine that they get, nor will we be publishing where or what organizations have what type of vaccine. Again, the whole goal being the best vaccine is the one available, and as much vaccine, whether it's the Johnson & Johnson, the Moderna, or the Pfizer that we can get into the county and pushed out to the community, the better. So
okay, thank you, Nathan. And let me just go ahead and check our Facebook again. Give me one moment.
The other advantage of the Johnson & Johnson, I forgot to mention, is the refrigeration. It can be in a normal refrigerator for weeks and weeks, and that's a big advantage, especially in small, and they come in smaller vials. They only come in, each vial has 5 doses in it, and it'd be easier to manage, especially in the small rural areas that don't have large facilities for cold storage. So that will be one advantage also.
Thank you, Dr. Yeka. And we do have a question that has been coming up recently. Is it okay to take pain relief medication after getting the COVID-19 vaccine?
It's not contraindicated, no. But you know, if you get, it's just like after any vaccine. If you have a small fever or anything, you can use anti-inflammatories or that sort of thing. We're not seeing that that bad of reaction to these vaccines, and I think they're about the same. The Johnson & Johnson might be a little bit minor, have less side effects than the others, and they don't have quite the allergic reaction that we're seeing, but we're seeing very little of that. That's been very minor in all the vaccinations we've been giving. So don't let any little mild sore arm or anything keep you from getting the vaccine. It's very good.
Okay, and let me again check our Facebook. Looks like there's no more questions. But I think we can move on with speaking about the new quarantine recommendations for vaccinated people. Oh, Dr. Yeka, I believe you're on mute.
I am sorry. The high tech has got me flustered here. Sorry about that. Yes, that's the one advantage of having of getting the vaccine. Yeah, the likelihood of you getting it from anyone exposed is very unlikely, and we don't recommend quarantine for those individuals, except maybe in a long-term care facility or something where they're such fragile individuals. We still will keep an eye on them, but for the most part, if you're exposed, there won't be a requirement for quarantine, which is a big advantage, especially in the workforce, keep people working.
Okay, thank you. And I am going to go over briefly where to check on our website, updated vaccine locations. So I'm going to go ahead and share my screen with everyone here. Okay, can you see my screen? Alrighty. So if you go ahead and go to our Yakima Health District.org website, you'll be prompted to this page. Go ahead and click on the COVID-19 vaccine icon here. And once you click on that, you will get to this page. First, we will see Washington's COVID-19 vaccine phase, so which phases we are currently on. After that, we'll have information on community events. This past weekend, we did have a few COVID-19 vaccination clinics. So whenever we do have information on those occurring over the weekend or throughout the week in the community, we will go ahead and update location, time, and how to register for those there. Below that, we will have current vaccine locations. These are locations that are currently scheduling for first dose, and here we have those there. They all may have different registration, forms of registration, either through phone or going on their website to check their availability. Additionally, if individuals don't have access to the internet, they are more than welcome to call the Washington State Department of Health's COVID-19 Assistance Hotline. And that's, the number is 1-800-525-0127. And I'm going to repeat that one more time, 1-800-525-0127. And again, this is a good resource for individuals who don't have access to internet. They can go ahead and call this number and they'll get help with scheduling their COVID-19 vaccine in their area. And also individuals can still call our office here at the Yakima Health District. Our phone number is 509-575-4040. And we can give them information on locations that are currently scheduling for COVID-19 vaccines. We can't schedule the appointments for them, but we can at least give you information on the clinics that are currently scheduling, how to reach them, etc. And if you do know someone who needs help with scheduling an appointment or finding to see if they are eligible, please go ahead and help them and give these resources to them as well.
And I'll also just mention that if there's anybody who needs transportation assistance, feel free to call 211 and they have some transportation services available to get you to and from your appointment if you need that. So that is also posted on that vaccine page as well.
Yes, thank you, Nathan, for that. So definitely keep checking our Yakima Health District website for any updated vaccine locations. You can call them directly. And if you have anyone, again, who has no access to internet, call the COVID-19 hotline, 1-800-525-0127. Individuals are still welcome to call our office, of course, at 509-575-4040. And like Nathan said, transportation, if you need help getting to and from your COVID-19 vaccine appointment, please call the 211 number. Alrighty, and then is there any other additional comments any of you two would like to share before we end our COVID-19 update today?
No, I'm just glad that we're going to be able to get our teachers and staff members in the schools and preschoolers vaccinated. I think that'll help us get the schools back open.
Yes, definitely. We're all very excited, and we will keep everyone updated as soon as we know more from the DOH, like Nathan mentioned. Alrighty, and then let me just check one more time to see if we have any last minute questions on our Facebook. Give me one moment. Okay, it looks like we do have one more. Does the vaccine hurt?
Does the vaccine hurt?
Yes, that's what the
No,
individual asked.
You know, I didn't even feel mine. It's you can compare it to the flu vaccine. And most of the time you don't feel it at all. If you relax your muscle when they give it, very seldom you won't have anything. So, and with that, I'd just like to add, really thank the health department, the staff. They've been working very hard through all of this, and I really appreciate all they've done. So I just want to thank everyone.
Thank you, and thank you to you both again for being able to participate in our COVID-19 update this week. So this is our update for tonight. We have no more questions. Please go ahead and join us in 2 weeks on our next update on March 15th at 6 p.m. It'll be live on Facebook again. Next Tuesday, March 8th, will be the Spanish weekly update. Thank you, Dr. Yeka and Nathan, for your time, and we will see you all again on March 15th at 6 p.m. Thank you.